All right. Hello, everybody. Good afternoon. It's Michelle Mahar here, and I'm here today with a woman who needs no introduction, the Honorable Mayor Bonnie Crombie from Mississauga. Thank you, Mayor Crombie, for joining me and giving me your time today to talk about these challenging times we're going through together and how we're maintaining a positive mindset, getting creative, adapting to working from home, and moving forward with business as well.
That's
Business as
right. Thank you,
usual.
Michelle. Certainly not been easy working from home, I've got to admit. I thought initially it would be.
Right. I think I find that this technology can be draining,
hmm
being on constant Zoom calls all the time.
I'm back to back, whether it's Zoom or WebEx or FaceTime or Skype. The technology is all very new for me. And then working from home has liabilities too, like the kitchen's too close between calls. My daughter makes fabulous banana bread, and then we have a cappuccino machine, so that's just happened a little too frequently.
Oh,
But
yes.
the technology's been challenging, and I don't have staff close by to help. So I've been doing all my own admin work too. So administrative work plus all the technology work. It's been challenging.
Of course, right. You don't have your
No. So when it comes to reading our council binders, our council continues to meet, but we meet through WebEx, and as does our regional council. There's that, and all the letters, which I need my signature and scan and send back. It's been a lot of learning of technology.
right. And well, you're lucky you have your daughter there, right?
That's
To
right.
help you with some of the Zoom calls.
Yeah,
Um,
fortunately, she's a consultant at Deloitte, so she says, I'm working too, Mom.
Yes, and that's the challenges right now. Everybody's at home working, and then you've got on top of that some people with their children,
That's
and
right.
possibly young children, and having
That's
to
right.
deal with the schooling and the technology. And I'm finding some of the people I know are having some challenges there with
And
in terms of
one of my counselors can't get onto the Zoom call, the WebEx call, excuse me, for council meetings because his kids are draining all the Wi-Fi because they're, of course, on school online.
yes, right. And all these video applications use a lot of broadband service.
Right.
So just a few questions for you in terms of you must have a morning routine. And
I
I
love
guess it
slow mornings. I do.
I guess it has changed since you're
Yes
working
and
from
no.
home.
Yes and no. The mornings don't change. I always give myself 2 hours from the time I wake up to whenever my first appointment is, and that usually includes travel time. But I wake up and I sit up in bed and I have an espresso machine close to my bedside, and have
Oh,
my
nice.
first double espresso, reading the overnight emails and the overnight mail. And then I just
Mhm.
check social media to see what's going on as well. So I do that, then hop in the shower, of course, hair, makeup, clothes,
Mhm. Yeah. Well,
which jeans I'll wear today with which blouse,
yes. Yes.
and then come down and have a bit of breakfast, read the papers. I'm very tactile, so I like to read morning papers and then get on usually the first call.
Right. Yeah. Yeah. I see.
The days
So,
days usually start at 8:30, not too earlier than that, not often. Not often. The emergency team, we meet at 8:30, the emergency response team. Those are
okay.
8:30 a.m. calls, and then Peel Public Health regional calls are at 5 o'clock. So I know my day will always start, unless there's a call, something needed sooner, with the 8:30 call, and then not conclude with the 5 o'clock at all, because there's a lot of ethnic media or even broadcast media that want to have interviews after 5. So not all, they don't end till 8 or 9. Sometimes later if there are webinars.
Right. And also on the weekend, I'm guessing. What's the weekend
Oh
like?
yeah, no, for sure. So absolutely, Saturday we did. I went and participated with a fabulous group of industrious Mississaugans who are calling themselves Feed Mississauga, and I knew they were doing this because they wanted to raise money to purchase PPE. And I suggested to them, I said, there are a lot of groups already out there doing that, and I think you're going to be stepping on each other's toes and possibly even driving up prices because there's a lot of competition for that right now. I said, there are a lot of elderly and those who are disabled, etc., who need food. Why don't you
Right.
deliver groceries, but they got into the packaged foods business, so they're preparing meals. I went up to the Mississauga Convention Center. There's a handful of folks using the kitchen at the Mississauga Convention Center, so thanks to Ann Boyd and Cliff Silvieri up there.
Nice.
And they had 125 volunteers of cars lined up to deliver food for people who have signed up. Many of them seniors, some are church groups, some of them were frontline healthcare workers at the different LTCs. So they were delivering 1,400 meals on Saturday. So I went up there Saturday morning. Yeah, and then I had to rush home because I was doing CP24 and I wanted to talk all about it, what I just heard. And then certainly
sure.
the media tend to be more media calls on the weekend, and touching base with counselors on what they're hearing as well. So I've been a regular on City TV, CP24, and CTV. They've been pretty good following up with me.
Right. Yeah. Yeah. Okay. So what are you finding that you do like when you work from home? Oh, I guess the Nespresso machine. No, you have that already, but
we have one in the office for that matter too. We love our coffee. I have a group around me. We love our coffee. So it's given me the opportunity to run a real focused way, reach out to many of our stakeholder groups. I'll just go through the list with you because we have done a lot of it, frankly. We're in our 7th week. And so each week we do a round of them. So the first week included our EDAB. EDAB is our Economic Development Advisory Committee. So after week 2, we wanted to talk to the small businesses and the business reps, the BIAs, and other business leaders, and including Mississauga Board of Trade, and said, what are you hearing? What else can the city be doing for you? At that point, we had already, deferred property taxes, deferred late penalties, deferred any of the utility charges, including the stormwater charge, allowed rear boarding on transit, and made transit free. So we had already passed a number of financial measures to provide some relief to our residents. Certainly, they were all interested in grants and subsidies, and we said, hold tight. That's not our role. We don't have the ability to provide that. But certainly the federal and the provincial governments will step in. And sure enough, they did. And we're very grateful for that. And I had to explain that we're not even allowed to run a deficit, and we don't have any revenue coming in right now. We have no property taxes coming in. The parking fees we normally collect, the interest payment we don't have right now. The fees we charge for use of our programs in our rec centers, we have absolutely zero revenue coming in. But yet we're still paying frontline essential workers. We're paying police, fire, paramedic, and we have our own PSWs for our regional long-term care facilities. So we have all that on our payroll, and transit workers, let's not forget those, and no revenue. So we're carrying, we don't have an ability to raise money. Lower tier municipalities can't do that. We're not allowed to run deficits, and we have no ability to recover these costs. So I meet weekly with large urban mayors across Canada. There are 23 of us. We call ourselves Big City Mayors Canada, BCMC. And then the large urban mayors of Ontario, we've met twice. Big City Mayors meet every week. So I've talked to them 7 times. I've talked to the large urban mayors of Ontario twice, but most of us know each other and communicate regularly anyways. And we've been lamenting, the operating revenue has been provided to many businesses. What about the cities? We're hurting too. So we're waiting to hear. We're very hopeful. Usually Thursdays we have calls with the Deputy Prime Minister or one of the senior ministers to talk about the financial situation among the cities. They want to talk about recovery, and the stimulus programs will be offered in recovery. And we said, that's great, but we got to get there first. Let's do it right. Let's do it the first time. We don't want a second wave. But meanwhile, we're paying essential workers, and we don't know how we're going to continue to do that. So for instance, a city like Mississauga, we're in a $43 million deficit today. I bleed $7.5 million a month just in transit fares that I'm not collecting. By the end of June, it'll be 60 million. And if this goes 6 months, it could be 90 to 100 million. We're the only level of government that has laid off people. Think about that for a minute. We're the only level of government that laid off people. We laid off 2,000 part-time workers that staffed all our rec centers, our community centers, our cultural facilities, our libraries, arenas. They're all largely staffed by part-time people. We had to lay them off. I mean, when the emergency, the initial emergency declaration was till April 5th, we thought, okay, well, we can carry people till
Right.
then. And
Yes.
then it went till May, and we thought, oh, we can't carry them another month. I mean, it's your money. It's your money.
Continuing.
We have a fiduciary responsibility to be responsible for residents' tax dollars. So we couldn't, that's right. And here we are in May. So we laid off everyone mid-April. It was April 17th, I believe. And we analyzed how many of them would collect EI or the CERB, the Canada Emergency Response Benefit. And we were even proposing to top up their EI. And we assume that we will be hiring them all back once we're through this and once all the facilities can reopen. But in the meantime, we couldn't carry it because the carrying costs were so severe. We've saved about 2.3 million just by laying off people. That'll be 8.5 million by the end of June. So there's a bit of savings, but there's no revenue stream.
Yeah. Okay. I didn't realize that the cities aren't allowed to run a deficit. So
not allowed.
It's
not
fine.
like the
it's
federal...
fine to say you're not allowed to run a deficit, but in this situation, what are you to do?
What are we to do exactly? And then we also don't want to entertain the idea of allowing us to run a deficit because we can't raise money. We have no ability to pay it back. So what we plan.
Right. You need you need some help.
We need help. Every year we know how much money will be needed to fund the programs and the services and the infrastructure plans that we have, the capital expenditures that we need. And that's the money we ask for from our residents, no more, no less. Sometimes we run a modest surplus, and if we do, it goes into reserve.
Right, and that's fine. That's fine. That's the general operation every year. But this is different. This is
so people don't
hopefully
realize that.
So anyways, in a lifetime.
So I hope so. Yeah, so we've met with the Economic Development Advisory Group twice. We've met with all the seniors groups. That was 51 groups, all on a WebEx call. It was quite interesting. Not all of them had WebEx. They were calling in, and not everybody could mute. So it was it was complicated, but we got through it. We got some great feedback from them. We met with the resident association groups. We met with BIAs. We met with religious groups, including the interfaith community groups. I met with the sports groups last week, and this week, tomorrow, I'm meeting with all the arts and culture groups. And they have a very wonderful plan as well. I'll share with you something called Rise Up, which will be broadcast next Friday, very similar to Canada Come Together. So all the local politicians will be playing in their homes or in their garages, and it'll be broadcast, all the Mississauga artists. So I'm very excited about that. That'll be Friday. Nice. That'll be Friday. So we have the opportunity to meet with all the stakeholder groups as I talked to and told them about what the city has done and what more we asked them, what more we can do and how they're suffering. And, you know, much of it is related to federal provincial matters, and we pass on their concerns to our federal and municipal provincial reps. And we have, you know, daily, as I mentioned, Skype, FaceTime calls with GTA media outlets. We still meet as a council on Wednesdays and every second Thursday with the Region of Peel. And after our weekly council meeting, I hold a press conference to inform the media what council has decided, and then to talk about the need in the community, which largely has been related to the needs for the food bank, because as you can well expect, they're feeding many more people than ever expected, and the need is very great. So we had kicked off one campaign for $840,000. We were successful, we raised it, and now we just launched another $1.2 million campaign last week. So I do that, or the need for the PPE drive for the Trillium Health Partners, the 3 hospitals. So we talk about other needs in the community, but more or less we talk about enforcement of bylaws, what council has passed, and then whatever needs exist in the community at the weekly press conferences. And for the most part, it's the only time I really plan to go out of my home office, other than I have delivered meals to frontline healthcare workers, flowers. The flowers we were going to plant in our boulevards, and we realized we couldn't do it and there was no point doing it. So we delivered them to the hospitals and just said, help yourself on your way out. Take some plants with you, brighten your day.
Okay,
so
the plants really you were going to, the city plants that you were
the city plants, yeah. I delivered some masks. It was a donation. And I was participating in a caravan around one of the long-term care facilities, delivered meals to a long-term care facility. And this week we'll do another caravan around the hospital with the sirens and first essential workers, police, fire, paramedic around the hospital. That'll be fun. That'll be great. It's so uplifting to do that. And then the other community consultation. So that's in 7 weeks. So I've not left home other than once or twice a week in 7 weeks, other than to do my grocery runs. I do weekly streaming on something called Mississauga, which is very popular. They do an interview with me. They do it with the Mayor of Brampton, and they do it with the Peel Public Officer of Health as well. I do daily videos. I don't know if you've seen them. We post them on my Twitter and Instagram and
Yes,
Facebook
I have
account.
seen some of them.
Those are just the updates of what's going on, and those are, we try to provide timely, accurate information communication to residents to let them know what's going on. Because as you know, in Mississauga, there isn't a lot of media. We don't even have the Rogers cable program anymore. We have the newspaper that comes out only a couple of times a week, and a radio station not everybody is very familiar with. So not a lot of opportunities to share information. So I find that if I do the daily broadcasts, they get thousands and thousands of views. So those have been very worthwhile, and try to keep, a very vivid presence on social media. I talked about the town. The other thing we do, and we're doing one on the 5th. Oh, it's tomorrow.
I know.
The teletown halls. We get we've had 50,000 people, so about 25,000 per call, whether they're on the phone or they're on the online Mississauga.ca online, or on Facebook Live as well. So we get about 25,000 people every time we do the teletown halls, and just an opportunity for people to ask questions from us. When will this all last? And when are businesses reopening? When are we going into recovery? What else can the city do? Blah, blah, blah. We try to group all the questions. They get emailed in or called in and into buckets, and then deal with them. And the commissioners respond to them. I respond to them, or our Officer of Public Health, Dr. Lawrence Lowe, he responds to many of them too, because many of them, don't forget, this is a pandemic, so it's a healthcare crisis. So it's public health that is leading it, not the city. It's not our emergency team. It's not me as the leader of an emergency. It is a public health crisis. So the public health officers are the frontline people who you see making policy and giving guidelines and direction, as you see Eileen Davila in Toronto, and you see Dr. Teresa Tam in Canada. So it's the teletown halls are great ways for people to get information as well. And I've done some voice drops, which aren't very popular with everyone, but the seniors like them because they often aren't on social media, so they do like getting those calls. I get it. Not everybody likes robocalls, but there is a segment of people.
Okay.
Voice drops. Voice drops.
Voice drop. I didn't know exactly what you meant, but
it's a robocall. Okay. At the end of the day, it's a robocall, which nobody loves, but they're good sources of info.
But you're right, for some of the seniors that don't have the social media.
That's right. They do like them. And I participate on, I had the opportunity to attend Michael Bloomberg has an institute called Cities Leadership Initiative, and they pick 40 mayors a year. And I did that program last year, and they have us on a call every Thursday afternoon to talk about issues, and we get advice and direction. And I listen to see what the American mayors are going through, because half of them are American, the other half are global, and I'm part of the international contingent. It's just fascinating. And of course, those mayors are going through what we are, but our premier is staging the recovery, the reopening, and moving slowly and deliberately and very safely, I feel. And their governors are not. They're very eager to reopen the economy, and the mayors are just petrified that things are moving too quickly. And of course, we're the ones on the front line. So we're the ones that will have to provide all the emergency services again. So I hear from those mayors that it's too soon for the governors are moving too soon to reopen the economy. And what we're trying to avoid is that second wave that could occur. So we've been saying here, we need 2 weeks of declining numbers. And right now we've pretty much plateaued. I mean, I've been getting 20 or 30 or 40 new cases, and now it's hovering between 25 and 35. I'll get 25 and then 30 and then 26 and then 32, and kind of up and down, but pretty consistent, a little
Yeah.
bit up and a little bit of down. I think we've had 22 days out of the past 25, 26 days that have been single digits. But the single digits are still representing 40, 50 people. We're out of the woods of the hundreds. We were getting hundreds of people early days, but that's over with. But until we have 14 days, because that's the incubation period,
Right.
14 days of declining numbers, it's not safe to reopen. So people have to be patient, and that's what we've been asking. And for the most part, they have been. Although yesterday,
Yesterday was a beautiful day.
I know, everybody was out. I drove through Port Credit twice, and oh my gosh, there were cars and people everywhere. Antique cars, convertibles, bikers, motorcyclists, cyclists, people walking, dogs, ice cream, everywhere. I was thinking, oh no. But I pray for cold weather and rain. And for the most part, this week will not be great again. We won't have really nice weather again for a while, and that's what I'm interested in. So that's what we've been facing day to day, pretty much. And then, as I mentioned, the two big initiatives have been the fundraisers for the hospitals, Trillium Health Partners, to buy their PPE. Because if you can imagine, when doctors, nurses go in to check a COVID positive patient, they have to wear full gown,
everything
gloves,
I've seen,
right? Mask, shield. Shields are critical too, because it's spread through droplets. When they leave, they have to take all that off, wash, and then regown to see the next patient. So that's why the PPE demand is so high. They can't keep reusing that. They have to change it to go in to see another patient. So the PPE drive, and then the food bank drive, because more and more people are using the food banks. So I talked about the calls with the big city mayors, the large urban mayors. I just tried to make some points here for you on what I do in a day and what I do in a week. And you can see there's and there's the resident calls in between, and responding to issues on their behalf. And we made a bit of a bold move last week, allowing the call to prayer, and we've been getting a lot of feedback about that.
Yeah, well, I'm sure you have a lot of residents contacting you and
all the time.
Yeah, for sure. There's so much uncertainty. Everybody's going through this.
And everyone needs hope and inspiration at this time. And when you all, you're cooped up in your home office, and I'm lucky I have a home and my daughter lives with me and I have some company. But imagine these seniors who have a small apartment, or they're in a senior's home and they have a small room, and, they're fearful and they don't have a lot of opportunity to communicate with others. It's really difficult. It's really difficult. I think about my mother. She's 84. She lives in a condominium, and she won't even let me come see her. She said, I saw you. You were out yesterday at the hospital with, you can't come over. I'm worried. And she won't let me in. And so she's had no company, but she's pretty good at FaceTime and makes calls regularly. So
yeah, we should be definitely grateful for this technology that we have. The other thing is, she doesn't have a pet, no pet, because that's something that also helps people get through.
Well, a dog would have to be walked. So she had a hip surgery.
No, but she could have a cat.
Yeah, she's allergic. She's never had a pet.
So there's some people that are not
pet people. I agree. I would love to have a pet. But right now we were thinking about buying a dog at Easter, but that too has passed. They're also a lot of responsibility. God bless them.
Oh yes, I know. I have 2 cats. I've always had cats. So cats look after themselves.
That's right.
You don't have to really worry about them as much. It's great to see the community coming together as well. I've seen a lot of that on social media, and with just people coming up with their own initiatives to
like the
buy
Food
groceries for the elderly.
was a great one, right? And even when you're walking around, I do still take walks, and you're in the community, you see windows full of messages, inspiring messages. Usually it's we'll get through this together, or, have hope, have love, we're one team Mississauga, or whatever it is. Lots of messages of hope around the community. There's some groups that have painted stones and left them at lampposts, or on walking paths. It's been great. So windows and painted stones,
Yeah, I've
messages of
seen
hope
all
and
those
inspiration.
stones with the messages as well. Yeah, for sure. And well, this when this first started and the schools were closed till April 6th, it and then the message was shut down businesses, all businesses on Ontario will have to close for 2 weeks or whatever it was like that. I think we didn't, now we're, like you
I
say,
don't think we
now
realized
we're
how
seven
long this would
weeks.
last,
Yeah,
right?
yes,
I mean, I thought at the
exactly.
beginning, we're going to shut down for 2 weeks and then we'll start reopening things and kids will get back to school sometime April.
Yeah.
Here we're thinking maybe June if we get those declining numbers. But until we get 2 weeks of declining numbers, we can't reopen things. When you look at the things that
No.
were open this week, they're kind of logical. I mean, they're out, most of them are outdoor businesses where
Yeah.
you can protect yourself, you can maintain a safe physical distance, and many of them are outdoors. So they did make sense. The prep work for marinas and golf courses, the gardening centers, the landscaping companies, the garden companies,
Yeah, but
they
again,
made sense.
curbside pickup.
Curbside, yep, hardware
So
stores,
that,
curbside pickup,
nobody's,
gardening centers, curbside pickup, exactly. No one's wandering in stores shopping. A lot of
right.
shopping
Yeah.
online. I think everyone's learned to purchase online. I know I
Yes, for sure. For sure. Although some of the stuff, it's taken some
have.
time to get to you now as well, though.
Yes, it's competitive. I am still waiting for a few things. Excuse me.
Yeah. So I think that we don't want to start it too early. Start the opening too early because we don't want that second wave. And I think I agree with what you're saying in the US. I don't know. I don't understand some of it. Opening some of the beaches. And I just spoke to somebody from Florida this morning, and some of the counties have opened restaurants, but only at 25% capacity.
Oh, I see. So that you can like every second table sort of.
Yeah, yeah, but I don't know. Does that really help the restaurant, or is it better to wait? And, I
Oh,
don't know.
outdoor cafes. Some people, I think Europe, they opened the outdoor patios and outdoor
Okay,
cafes.
because outdoor would work better. Yeah,
Outdoor. Mm-hmm.
right. But I think so. I think that this is giving the chance to businesses,
Mm-hmm.
whether it be corporate or small business entrepreneurs, to get creative and start, figuring out new ways to do business. And I think we're going to
Yeah.
see some of that going forward with the popularity of Zoom and the web conferencing.
Yeah.
It might be something that will be used,
The companies are being really
going forward.
nimble and they're learning how to use technology better to market themselves. I have a girlfriend who has a sort of sleepwear, lingerie, swimwear business based in Oakville, and she's calling herself the Ubra deliverer, not Uber, but Ubra. And she talks to her best clients online, and she shows them things, and she knows she's got all their sizes and whatever, she knows who they are, and then delivers it to their door. So she's been able to, kind of shift her business into one of
Yes.
delivery, and good for her, because God bless her, that'd be a tough business. Just small retailer. She has overhead, and
And she has a
so
brick and mortar store. Yeah.
that's right.
Right.
And so God bless her that she's been able to use online to show people her goods, her inventory, and being able to call her good customers and be able to sell to them and then drop it off to them. So God bless her, she's keeping her business going. Of course, not 100%, probably
Not
not
at the
even a
same
50%.
capacity.
Correct,
Right.
but she's been able to adapt and adjust quite nimbly, and I know many businesses are. I was on a webinar earlier today with many of the manufacturers who have retooled, since they're not really in production
Oh,
for
yes.
what they typically do. So they've been able to retool to make, some of the spirits companies are making hand sanitizer, right? Because you need that heavy alcohol
Right.
content. Some of the other manufacturers are making face masks or shields. Of course, that's what we need. Others are trying the ventilator business, etc. So companies have been able to retool to accommodate the growing need for PPE and the medical needs that we have in our community.
Right. Yeah, and I've seen that a lot as well.
Mm.
So yeah, just I guess it's become kind of a new routine now, because we're into our 7th week. Initially, it was a lot of the fear, and everything was changing minute by minute, hour by hour, and I think that first week when it was March break felt like it was 6 months maybe or something,
Mm-hmm.
because
Mm-hmm.
everything changed so much. Now we've kind of got into this routine, and I guess, like you say, the reopening is going to be something staged, and the direction will be coming from the medical officers.
And they'll do it probably province-wide, so it's not left in our
Province-wide.
hands, right? Not
Right.
left in our hands. And
Yeah.
sort of the GTA mayors, we've met a couple times as well. John Tory's done these conference calls with all
Yeah.
of us, and we've talked about, whatever we do with respect to our own facilities, we'll do in tandem, in unity as well. So there's consistency. So when the park facilities open again, parks are open, but the facilities are closed, right? The basketball courts and playgrounds, etc. And we
Yeah.
did that because people were gathering and we couldn't ensure that they were clean and sanitary. So
Right.
we decided that we would do that in unison as well. So there was consistency right across. So, if you're driving into a park in Burlington or Oakville, the same rules would apply in Toronto or Mississauga.
Right. Although I did see this weekend, I drove by High Park and they made sure to shut that down because of the cherry blossoms.
Well, and we've closed Korea Park as well because of the cherry blossoms, and we have a Korea uh, blossoms cam up as well. So if you go on Mississauga.ca
Oh, so that
coronavirus
you can see.
webcam, you can see them. But I will share with you one of the COVID tickets, which was a $750 fine, was issued to a group of youth who broke into the park to take Instagram photos next to the cherry blossoms. So that was a very expensive Instagram posting.
Yeah. Yeah. But when I did drive by High Park, there was a lot of police presence. So
Yeah.
they
Well, the
were
same as
really, and the
well, they did it in the middle of the
pylons and
night, I
everything.
think. Yeah, but they did. Ours is closed too. Korea Park in
And again,
Mississauga.
if you can't stop those people, I guess, but that's what's going to happen to you if you think you're going to break in.
Mm-hmm, mm-hmm.
Yeah. So I guess that's, any final things, any final thoughts
The only other
or
thing I find
shout outs
disturbing,
or,
yeah,
oh,
no, let me just deal with one thing that I have seen as well, is a lot of uh, dumping of garbage. And I think that's
oh
so
yes.
unnecessary because everyone is allowing extra garbage to go out because we realize you're at home and probably cleaning cupboards and purging too. So we're allowing extra trash. And then it's the unsafe disposal of PPE materials. So
Oh my
and
gosh.
now
I saw,
many of the grocery stores are actually going to be requiring you to wear a mask. I've heard from Longo's, Walmart, and
yes,
Costco, I
Longo's,
think.
yeah,
Longo's and
Longo's
Costco,
today.
Walmart, I think, are now requiring a mask to go in. And so I have seen in the parking lots people just disposing of their gloves and their masks and just casting them aside. Like, folks, that's litter in the best of times. Now it could be a health hazard. So please unroll your gloves, take off your mask, put them in your pocket or put them in a waste bin, but you don't discard them in the parking lot or the side of
No,
the road or in a park. I mean, I've got the waterfront trail right by my home and I've seen them on the trail. Like, really? Disposing of your mask on the trail. I don't have people coming to clean the trails behind you. Your mother isn't walking behind you. So folks, please pick up after yourselves. It's litter. If you're caught, it is a $350 ticket. So
yeah.
please, you will be charged with littering. And we have issued 40 littering tickets. 40 of
I
PPE. It's
yeah,
astounding, isn't it? It's
I
astounding.
cannot believe that people are doing that. I don't understand. Like you say, it's worse than littering because of the health hazard. But
Also,
what would
well,
possess you to think that you can throw it on the ground?
right.
Like, it just
Getting
so
into your car,
strange.
I guess I'm done with this and throw it away. I have no idea, but it's happening and we've all seen it. So let's
Yes.
stop it from happening. And the other thing is respecting Highway Traffic Act. I find that I see a little bit of malaise. I see a little bit of speeding. I
Crazy
actually,
drivers.
I have seen that.
I've
I have
seen
seen,
crazy drivers.
I have seen people not respecting red lights. I have seen the
All
general,
red
I
lights.
won't say lawlessness, but I've seen people taking advantage. Certainly the speeding and bad driving and
Yeah,
driving through red lights. So, it's a very difficult time for everyone, folks. This is the time we need to pull together. We need community around us. We need that community spirit. And we need everyone in this together. And we won't get through it unless we do it together. So I encourage everyone to think about somebody else. If you think that if you were to contract the virus, you would have a mild flu, good for you, but you could pass it on to somebody who could pass away as a result of contracting the virus. Let's protect those seniors. We know that the average age of those passing away, 78% of those who've passed away are over 75. They're largely male, but there have been women, many women as well. It was about 60-40.
Yeah.
So let's protect people with underlying health conditions and our seniors. We knew that the long-term care facilities would be that kind of final frontier. We were trying to protect them and our seniors. But you know, if you're not thinking about yourself, then please think about others. What I'm asking people as well is to make calls. Call someone in your greater circle, check in with them, particularly if they're elderly, check in with seniors, see how they're doing. They're isolated and they're feeling depressed. So call people, call friends. Many people are in self-isolation. Call them, see how they're doing, check in on them. Maybe you're well and they're not, or they're isolating. And if they're seniors, maybe you could pick up a bag of groceries when you're shopping for them as well, or run to the drugstore to pick up their meds for them so that they don't have to go out. It's a risk for them to go out. So please, let's pull together in this time. And when we do, we'll get through it sooner. And we'll get back to whatever the new normal will be, which will be safe distancing for some period of time, I expect, and maybe some mask wearing as well until the vaccine is discovered.
Right. Yes. Yes. I think so too. I know my friend's mother has tested positive. She was in a long-term care home, and I also know somebody else whose wife passed away. You know,
we've 350 cases. We've had 55 deaths in 15 homes. So, I mean, they are recovering, but certainly it's a lot harder, a lot more difficult when some of our seniors contract the virus.
Yeah, and like you say, you can be asymptomatic, not even know. And there's been some people who have had it and not really had any sickness.
A mild flu, thought they had a cold or something like that. Strep
and yet you can
whatever.
pass it on. So that's why it's important, and that's why it's important to you know, to wear the masks and the social distancing as well.
That's right.
Yeah, for sure. All right. Well, thank you so much for your time.
Thank you for having me. Stay healthy, stay safe, and stay home.
Yes, yes. I am
been my mantra.
To do that.
It's been my mantra every day.
Yeah. Yes.
Thank you very much, Michelle. You stay safe.
All right.
Take care.
Thank you.
Bye-bye.
Thank you, Madam Mayor.